Hi, I'm Claire from Koala Northwest, one of the breastfeeding coordinators, just doing a short video on hand expressing. So we might want to hand express shortly after birth when milk comes in, usually sort of any time after the first few days, and sometimes we can get a little bit engorged if we're not getting the milk out quick enough. So that can make it a little bit difficult for baby to latch, so hand expressing can be useful for that. We may want to do it further along the line when we're introducing solids, and I want to mix it with some solids that we're introducing to baby, or maybe even when we're returning to work if we need to express for whatever reason that we need to be away from baby. So the best thing to do to get an effective way of expressing is to be as relaxed as possible. Obviously when you just had a baby, sometimes this is not as easy as it sounds, but if we can have baby close to us, if that's possible, so we can see baby, smell baby, touch baby, anything that can relax us and get us thinking about baby. If for one reason or another we can't be with baby, if we can have a picture or a video on our phone of baby whilst we're expressing, then that can help bring the milk out quicker. So relaxed state, if we're getting our breast, if we want to do some gentle massage, we can do that with our fingertips or our knuckles, obviously a really soft knuckles. Obviously, if you are engorged and it's quite painful, we want to be as gentle as possible, not causing any pain. So gentle fingers, little massage, anything that will warm up the breast. A warm breast will help the milk flow much easier. So gentle massage all around. And then we want to be getting a C shape with our fingers. And if we start from quite far back on the breast, obviously depending on how large the breast is, but if we move towards the areola, when we're coming down, we should feel a sort of gristly part, usually as we get towards the edge of the areola. Once we get there, we want to be doing some gentle compression, just making sure that you can see that easily. So we're doing gentle compression in the same spot. We're not dragging along the skin in any way, we're just doing gentle compression. You might need to do this, especially if it's the first time, you might need to do it for a minute or two before we see anything at all. And then even when we do, we might only see maybe a bead of milk or a bead of colostrum coming out if it's at the beginning. And we just keep doing that until we can't see anything else coming out. If that subsides, we then move around the areola, so we can do it in a clockwise fashion, so whether it's clockwise or anti-clockwise, however way you want to do it. So we'll move round, and then we can bring the other hand in as well, again, for a few minutes each time, or until the milk subsides or colostrum subsides, so we can get from around that angle as well. But it's important not to be dragging along the skin causing any abrasion or anything like that, so just gentle pressing. We want to be collecting that into a sterile container, and then we can, depending on what we're going to be using it for, we could be drawing it off for a syringe and freezing it, or into another container or a sterile storage breast milk bag.